Hi, everybody. My name is Taylor Spaziani, and I'm the Denver Director for the Sexual Health Alliance. Today, I'm here with Pebble and Dan. Thank you guys for being here with me today. I really appreciate you taking the time.
Thank you.
Our pleasure.
We're delighted to be here.
Thank you. So to get started, would you guys mind telling us a little bit about yourselves and your careers and how you came to specialize in what you do?
Sure. You want to start since your career started first?
My career is right. I was a general psychotherapist till uh, about 2008, where I started studying sex therapy. A friend of mine suggested that, and after I put on some trainings in town, and over the course of earning my ASEX certification and studying couples counseling, I would come home and talk to my spouse and now business partner, Pebble, and tell her some of the things that I was talking about with people, and she would get really frustrated as a physician that sexual problems were being handled in a way that she thought could be done a little more effectively. And so I let her tell her journey. But for me, it's been psychotherapy, couples counseling, trauma work with EMDR, and ever since I got my MSW back in, oh gosh, a long time ago, I've been doing counseling.
Yeah. So I've had a varied career. I started my life in the world of theater, professional theater, and then went into medicine in my late 30s. And at that time was really engaged in family medicine because it seemed to me the area that was most focused on the whole person, the whole community, and person-centered. And I studied family medicine. I became a family doctor. I was on faculty in our Department of Family Medicine with a focus on teaching residents about psychosocial aspects of primary care, and that would be the things like emotions and attachment and social needs and their impact on medical issues, and specifically on the provision of primary care. Even in that, there wasn't anything that addressed sexual function or helping my clients with sexual function. And even before I met Dan, I found that there were issues that were coming up for sexual concerns in my patients in my primary care practice that I was not able to address, and I couldn't get help from my faculty. And so Dan and I had our first date while I was a chief resident, and he mentioned that he was becoming a sex therapist, and I thought, well, this could be interesting. There will be a second date. And through talking with him, through learning, going to conferences with him, I realized this was an area of medical care that was even more interesting to me than family medicine. And there's sort of a through line from my life in theater to my life in sexual medicine. I'm really most interested in people's stories, the stories that are deepest and most important to them. And so here I am with the most rewarding medical care that I could imagine being able to provide in sexual medicine.
Wow, that's so cool. I'm very respectful as well. I really admire the two of you and the work that you do. This is amazing. What a cool
Thank you.
couple. So with that, do you guys want to tell us a little bit about your relationship and the work you've done together?
Well, we're married.
We are.
We're married, and we're life partners, I think is the way we like to think of it. And so two and a half years ago, Pebble thought big, kind of the field of dreams. If you build it, they will come, and thought we should open the Rochester Center for Sexual Wellness. And now we have, I'm not the only clinician there. We have 2 other clinicians. We're going to have interns. And so it's growing, and we work together as a team. It's really nice to have a whole team helping people with their sexual problems and general mental health, because that comes up too a lot.
Right. It's, I think I love the question that to take a jump on a question that you were going to have later about radical collaboration. And this is really the thing that we both strive for, is a collaboration between the patient, therapy, and medical care in order to achieve people's goals. And both of us have found it difficult to really achieve that kind of collaboration between mental health care and medical care in settings where we aren't on site with one another, being able to have directed and formal consultations with our collaborators, but also informal consultation. You know, I just had 3 patients who have had anorgasmia with Trimix. How does that happen? Is that a thing? So Trimix is a injection treatment for erectile dysfunction. And
you're supposed to be able to have an orgasm.
And you're supposed to be able to have an orgasm.
Right.
So I think our working together is really meeting both of our needs about collaboration. And on a personal level, if this is sort of the baby that we have together, is this practice. And it's growing. It's growing. It doesn't grow at the same kind of a pace that a living, breathing human does, but,
Right.
but it grows.
Yeah, absolutely. And I think that is so beautiful because, you know, as everybody knows at the Sexual Health Alliance, that's our slogan, is provocative dialogue and radical collaboration. And I think you two are the epitome of radical collaboration. I think you define it for yourselves in that way. That's really, really cool. So, working together, have you two ever had any shared patients and work with wraparound care for the patient?
Absolutely. Sometimes patient referrals flow in both directions. So we take patients where they want to come into the system. So if they come in with a sense of really the kind of care I want to get for my sexual concern is therapy, then they start in therapy. And if they come in with a sense that, well, I want to have a medical evaluation, I want to see what the options are for medical care, then that's where we start. And it's quite common that a patient will start in one of those ways, and then as we work with them, we realize you're really going to get more of what you want. You're going to achieve your goals faster if you have the support of therapy, or if you have the support of medical treatment. So we've seen a lot of
some people come.
together.
We've done a couple intakes together too, where we everybody meets together, which can be really nice too.
But particularly when people are coming from far away. So we're in New York State, but we are, as I was saying before, nowhere near New York City. So this is a region where there aren't a lot of sex therapists, there aren't a lot of sexual medicine providers, and as a consequence, sometimes people are coming from hours and hours away. And so we want to be able to give them care that way. But we've had some great success with clients with early ejaculation, with early orgasm, where they've had a lifelong issue with early ejaculation, and it's been really difficult and traumatic, and they've been working in therapy, and they're not making the progress to their goals and their sense of sexual well-being. And then we're able to include medical treatment for that and work together on that. And it can be magic. And sexual pain is another issue as well, where a collaborative approach is really critical, because it's very rare that simply having a medical fix, if there's been sexual pain that's a part of a person's experience for a long time, a part of an experience in a relationship for a long time, it's very rare that a medical fix is going to fix the whole thing.
Yeah, absolutely. So thank you for sharing. I think you two are a really rare breed. I feel like you don't really see much of medical professionals working within the same practice as therapists, especially in the field of human sexuality. So I'm wondering what you guys think about the future of sex therapy and sexual medicine, and how they might continue to work together for the greater good.
I don't know how they'd work apart.
Yeah, right. I don't know how they manage to work apart.
Yeah, I think that there's been too much, too much separation. I love, for example, Gerald Weeks, Nancy Gambesian, and Catherine Erdeline have been working so hard Barry McCarthy, to integrate, and I'm sure there's others too, but to integrate sexual medicine and sex therapy. We have, so we wrote about, some of the questions you're asking, if people want a more expanded vision of how we do it, is in a chapter, our first collaborative chapter.
About collaboration.
In Tammy Nelson's book, now watch, I'm going to forget the title of the book right now.
Integrative Sex and Couples Counseling Therapy. Integrative Sex and Couples Therapy.
Right. And so you have to work together. And so here's one of the things I think is fascinating, is that as a general psychotherapist, therapists are generally non-judgmental. Of course, we're non-judgmental about discriminatory things. But people are like, well, if you want to get over your problem, you could get over your problem. Or maybe you'll just, live with your problem, learn to live with your problem better. So mindfulness is a lot of kind of like that. But as sex therapy, we try to take an approach of really building people's sense of agency to overcome their sexual problems. You can't always do that, but you want to build that sense of agency. And so people need support. I find that psychotherapy clients need support to advocate for their medical sexual health needs.
Right, because a lot of
they don't want to do things. They want to do things naturally. When naturally is great, but there's things you can't do naturally, and helping people get over that hump sometimes can be helpful.
Right, and particularly when they have been their medical concerns that they've tried to address in medical care haven't been fully or well addressed. And so they're helping them advocate for their own care medically is particularly important in this way, even more than it is with helping somebody who is coming in with anxiety and depression and has diabetes and needs help advocating for the medical care for their diabetes in order to help their anxiety and depression. This is even more so because they're getting a more complicated view from the medical providers that they see sometimes.
So as I reflect on this to try to give a more comprehensive answer, the future would that the few sexual medicine specialists that there are might be able to have a consultative role with primary care physicians, urology, and OBGYNs, so that their knowledge can spread throughout other sectors of the medical field, because we're never going to train enough sexual medicine specialists. The same is true for the Sexual Health Alliance. I love how it's crossing lines, cross-discipline training. We're never going to have enough certified sex therapists to meet the need out there. So to play a consulting role where we're helping generalists to provide better sexual care and to get over some of the old ideas that may have, for example, that testosterone therapy is bad for your heart health, whereas the current data is the exact opposite. It's often an important ingredient in cardiac health.
I could not agree more. I admire the work you both are doing so much. Thank you for being out here and doing this work. So what is some bad advice that you guys have heard people in our field give out?
Well, in the medical field, there's so much bad advice. And I find myself saying in the teaching that I do to medical professionals is, please stop saying, please have, just have a glass of wine. Please stop saying, use it or lose it. Please stop saying, pain is a normal part of the process of sexual experience. So as far as medical doctors go, there's so much bad advice.
But we're a teeny bit forgiving because they haven't had the training. It's bad medical advice, but sometimes it comes from a place of
not having any other resources.
Yeah, right. Not having resources.
So, and as far as people in the sexual health community, I think one of the things that's difficult sometimes is that medicine is sometimes seen as the enemy.
Mm-hmm.
And while in no way is Viagra or the medications like it, or bremelanotide, Vyleesi medication for low sexual desire in women, in no way are any of these medications panaceas. They do not solve everything. They cannot, but they have a role sometimes. And it's important for people to be able to get the care that they need. As Dan's daughter is fond of saying, people are different.
Yes, they are.
and people need different approaches to care. And so I think that's one of the things that we really enjoy being able to provide as well, is a place where people can get a wide variety of kinds of approaches to addressing this issue, and that they can achieve not only well-being and an improved sense of well-being within themselves, but also resolution of their sexual symptoms.
Absolutely. Yeah, I think that's so important, this discussion of how every client is going to be different. Every patient is going to have different needs. And especially when working with the two of you together, that allows them to provide their specialized treatment within the same place. And I think that is so cool, so admirable. So now I kind of want to know just a little bit more personal things about you two. So if you don't mind sharing, what are some of your most important everyday values?
Kindness.
Yes.
Honesty. Vulnerability.
Yeah.
Agreeing to disagree.
Yeah. That's very valuable.
Incessant yabbering. That's all we do. Just talking to each other all the time. Never shut up.
Hey, that's needed too,
And flirting with something that the people who do the conscious loving workshops talk about is to never criticize your partner. One of the first things Pebble told me when I met her was, I criticize myself pretty well. I don't need you to help. And trying to integrate that more and more into our life.
Oh, I love that. I could take that into my own life as well. So one of my favorite questions I love to ask people within this field, the whole field of human sexuality, is who is your sexual role model?
Well, mine was easy. We were talking about this on a walk this morning, and I was like, Betty Dodson, no question. Though I do have a number of other role models as well. I hesitate to even call them secondary role models.
Yeah.
I have we did some trainings with Gina Ogden, and just saying her name makes me feel emotional.
Oh,
And Peggy Kleinplatz also has really, in terms of thinking about medical aspects of sexuality and integrating such a hopeful and focused on the extraordinary experience that's possible in sexuality. I appreciate her for that too, really a role model in that
beautiful.
way. What about you?
I know. I'm going to have to say Pebble.
Oh, that's
For, move like the way she kind of embraced the interest that I had professionally. So for me, it's constantly about striving for more to understand myself better, and I think Pebble represents that. I love the three women that she talked about, but you got to think, it was a male sexual role model. I don't know. I think I'm looking for that, trying to find who
right.
who that is.
Beautiful.
If you're out there,
I'm
contact me.
Well, that's beautiful, you guys. Thank you. Do you guys have any bucket list items that are on the very top of your list?
Well,
We
both,
do.
when we were talking, again, we talked about this this morning too, and here we are in the time of COVID and presently in our house and doing all of our work out of our house and doing all of our living out of our house. And one of the things that we both love to do is travel. And I'd like to circumnavigate the globe, but that's just not going to happen anytime soon.
But we've done it before, but early in the year, around New Year's, the resolution time, we talked about this being a year of pleasure, that we're going to focus on the year of pleasure and prioritize that and having fun. So we just ordered our backyard inflatable hot tub.
Oh, cool.
And we would be traveling more. But trying to have fun, the whole idea of a bucket list before you die. And I don't want to save it up. I want to do it now. And so I'm trying to live that, an integration of a bucket list and mindfulness is do it now, if you can. And, but on a personal project level, we do have some personal projects, at least I do. So I have started a podcast, which I'm hoping is going to start releasing today.
Oh,
I've got 7 recordings, I think, and it's called On Listening. The URL is going to be onlistening.net. And of course, I'm going to interview a lot of therapists and sex therapists, but the general topic is listening, and it's been really fun. It's just been a blast to do it, and I'm hoping it'll keep going and going.
I love those answers. You guys gave me chills. I love this year of pleasure idea. That seems like something we all need to invest a little bit more in.
Yeah, really prioritizing it. It's critical.
Yeah.
I think I don't know that I will remember her last name correctly, but SHA that did a presentation at ASACT a couple of years ago about the radical political nature of pleasure. Mm-hmm. And I do think that's true. It's challenging to figure out how to fully incorporate into modern life.
Sort of the final frontier is moving towards pleasure. And I guess you asked something about our values. So seeking pleasure is definitely one of the values, and mostly won't get you into trouble.
Yeah, no, that's amazing. Definitely a value I think everybody should prioritize. Yeah. Well, I know you kind of just mentioned your podcast, but I want to give you the opportunity to roll out the red carpet for you and share with the world about some of the projects you're working on or anything that you want to share with the world.
Well, we mentioned our book chapter, and we mentioned our podcast, and come to Rochester and get a workup with us if you need. I'm doing I'm really enjoying the group therapy that I'm running. I'm running a group, interpersonal process group, and I hope to start more of that. It's a great way, and with a specialty in sex and sex therapy, allowing space for that to come in, for people to talk to other people who might have similar issues as themselves or hear other issues. It's really so nice to get people to have open dialogue.
We also share a commitment to the training of generalists. It's wonderful to have sex therapists. Right. It's wonderful to have sexual medicine specialists available, but truly it's general psychotherapists, general medical providers that need to be the front line for helping people achieve their sexual goals. And so we do a lot of training of generalists, and I would say that my red carpet item would be getting even more word out through publications and through presentations and through teaching, helping to create curricula for medical schools, helping get the word out to general medical providers about the importance of sexuality, not only prevention of sexually transmitted infections and reproduction, we got those pretty well, but really bringing pleasure into the sexual conversations that happen with medical providers.
Yes, absolutely. Well, thank you so much, Pebble and Dan. It was a pleasure speaking with you guys today.
Yes.
I cannot wait to continue following your journey and seeing where this all goes. And I look forward to talking with you soon. I hope everybody enjoys this interview just as much as I did.
You did a fantastic job. Thank you so much, and to the
Thank
whole
you.
Sexual Health Alliance for inviting us and collaborating with us, as radical as that might be.
Right. Thank you.